A very good morning, dear students. So let's continue our lecture. And today's lecture is walls of thorax. We have already studied about the thoracic cage. The thoracic cage, this forms the skeletal framework for the wall of thorax. Now you are already aware with the various bones which form the thoracic cage. Yes, can you name them? This bone is sternum. It has a manubrium and the body. These are the ribs, the 12 ribs. And on the posterior aspect, we have the vertebrae. So these bones form the thoracic framework, the thoracic skeleton. There is one term that is known as intercostal spaces. These are the spaces between two ribs and they are numbered for the rib superior to it. For example, the intercostal space between the first and the second rib. First and the second rib, the space would be 1. Likewise, between the second and the third rib, the intercostal space would be 2. So the numbering of the spaces is according to the superior, it is dependent on the superior rib. Okay, so there are 11 intercostal spaces on each side of the back, and we have 9 intercostal spaces in front, and the last 2 spaces they open anteriorly. The floating ribs, do you remember? Yes. If we see the features of this space, the intercostal space, if we see the direction, they are downwards and forwards. That the direction of the spaces downwards and forwards. Now we come to the joints which are formed. The joints on the posterior aspect is between the rib and the vertebrae, also known as costovertebral or costotransverse. Costotransverse means between the ribs and the transverse processes of the vertebrae. In the case of costovertebral, the joint is formed between the ribs and the body of the vertebrae. And costotransverse joint means between the ribs and the transverse process of the vertebrae. On the anterior aspect, the joints are sternocostal or sternochondral, that is between the sternum and the rib itself, or the sternum and the cartilage. These are the synovial joints. Exception is the first one, that is also known as synchondrosis. Here the meeting part is hyaline cartilage. Now these intercostal spaces, what do they have? These are spaces, they have the muscles, different muscles. We'll study later. The vessels and the nerves. So in the intercostal spaces, we have the muscles, artery, vein and the nerves. Let's see this slide and we can see the intercostal spaces, the spaces between the two ribs. Now let's study about the ribs. That is very important. This is a typical rib showing you the anterior part and the posterior part. The various parts of the ribs are, it has a head, a tubercle, that is elevation, and where it bends, it forms an angle, that is known as the angle of the rib. This is a shaft or body of the rib, and a junction. This area, anterior one, is known as the costochondral junction. Costochondral junction. Let's see another slide of the rib in which we can see the external surface of the rib and the internal surface of the rib. This is the head which has to form a joint with vertebral body, the vertebra. It is in contact with the vertebra. The tubercle, the center part is neck, the tubercle, and this is the angle. And there is one more area, that is, you can see over here, this area is known as the costal groove. Costal groove is the area where we have the intercostal vessels and nerve. Van, V-A-N, vessels, vein, artery and nerve is in the costal groove. You can see the costal cartilage anteriorly. Now if you see the superior border of the rib, just please concentrate over here, the superior border. Can you see the two lips? One is the outer lip, another is the inner lip. It has two lips. It is actually very thick and it's rounded, and it has two lips, the outer lip and the inner lip. That is for the attachment of the intercostal muscles. The various joints we just talked about. The first joint with the head and the vertebral body is the two vertebrae is the intervertebral body. Head is the joint between the head and the vertebrae, that is the costovertebral joint, and costotransverse joints. So three joints you can see in this slide: the intervertebral joints, the costovertebral joints and the costotransverse joints. Costovertebral and costotransverse joints are the synovial joints. Now we come to the main thing, that is the coverings of the thoracic wall. The thoracic wall is covered from external to internal, we are talking about, or from outside to inside. In order we should always explain. So here we have the outermost structure is the skin, below skin is the superficial fascia, then is the deep fascia, and then you have the muscles. The muscles are of the upper limb also, abdomen also and the back also. You can see the skin. Below the skin is the fascia, and here you can see the three layers of muscles. These are the intercostal muscles, and in between the intercostal muscles we can see over here the structures, that is intercostal vein, artery and nerve. After that we have the pleura, that is a covering of the lungs and the lung itself. This is the arrangement of various layers in the which constitute the thoracic wall. What about the skin? If we see the features of the skin, it is thin on the anterior aspect and it is thick on the posterior aspect. Why? The skin should be anterior, so it should be thin on the anterior aspect and should be thick on the posterior aspect, because when we lie supine, the body has to bear the pressure. And the distribution of hair on the thoracic region is variable depending upon the age, sex and race. We also have the cutaneous nerves. The nerves, these are the branches of the cutaneous branches of the anterior primary rami of thoracic spinal nerves. What about the fascia? Fascia is also dense. Yes, skin is thick, fascia is dense. This is to sustain the pressure of the body. In the case of anterior aspect, in the case of males, it is not well developed, but in the case of females, it is well developed. Why? Because of the presence of one gland, that is a mammary gland. The deep fascia is thin and it is ill-defined except in the chest region or the pectoral region. It allows the free movement of thoracic wall during breathing. Now we study about the various muscles. The muscles are extrinsic and intrinsic. Extrinsic means which are not confined to this area, that is the thoracic region, and intrinsic muscles are those which are present in, that is the origin and insertion is in the same area, that is the thoracic region. Now what about the extrinsic muscles? In the extrinsic muscles, there are the muscles of the upper limb which also form the thoracic wall. These are the pectoralis major and minor, pectoralis major and pectoralis minor, chest muscles, serratus anterior, serratus anterior. These are the muscles of the upper limb. The muscles of the abdomen are rectus abdominis, the external oblique muscle. These are the muscles of abdomen. Then muscles of the back are trapezius, latissimus dorsi, levator scapulae, rhomboids major and minor, serratus posterior, superior, and inferior erector spinae. These are the various muscles which are the muscles of the back. The extrinsic muscles we have already studied. Now what about the intrinsic muscles? Intrinsic muscles, they are arranged in 3 layers from superficial to deep. The superficial muscles are, these muscles are external intercostal muscle, below that is the internal intercostal muscle, and then we have the transversus thoracis muscle. So 3 muscles, 3 layers: external intercostal, internal intercostal, and transversus thoracis muscle. This transversus thoracis muscles is constituted by 3 subtypes or 3 types of muscles: intercostalis intimae, intercostalis intimae, subcostalis, and sternocostalis. These 3 muscles, they are the transversus thoracis muscle. And the muscle layer internally, it is lined by the endothoracic fascia, which is in turn lined by parietal pleura. The function of these muscles are to prevent retraction during inspiration and bulging during expiration of the spaces, the intercostal spaces. This slide is showing you, on the left side is the inspiratory muscles, on the right side is the expiratory muscles. This muscle is the external, the main muscle of inspiration, that is the external intercostal muscles. And this is the cartilage, and there's one more layer of muscle that is known as the internal intercostal muscle. The main function over here is to aid inspiration. That is, these muscles, when they contract, they elevate the ribs and enlarge the rib cage. When this muscle contracts, it will elevate the rib cage, increase the space, and hence help in inspiration. On this side, again we have the internal intercostal muscle, but not the intercartilaginous portion. This muscle aids in expiration. Do you understand this? Inspiration, expiration. When the muscle contract, they do the respective jobs. Let's study about the origin of the external intercostal muscle. The origin is from the lower border of the rib above the space. Lower border of the rib above the space, and insertion is into the outer lip of the superior border below. Origin is from the lower border of the rib above the space, and insertion is into the superior border of the rib below, that is on the outer lip. And the direction of the fibers are downwards. They move downwards, forwards, and medially in front. It is just like when you put your hands in the front pockets of your pants. Okay? Downwards, forwards, and medially. See this slide showing you the external intercostal muscles, and see the direction downwards, forwards, and medially. Downwards, forwards, and medially. You can see one more slide. We have taken up the section from this area, and you can see the external intercostal muscle from the lower border of the rib above, and it is attached to the outer lip of the rib which is below. That is, in fact, this rib's superior border, outer lip, is the attachment for the attachment of the external intercostal. And you can see also this there is one more muscle, and that is known as internal intercostal muscle and innermost intercostal muscle, that is the transversus thoracis. Now let's study about the internal intercostal muscle. Internal intercostal muscle is present internal to the external intercostal muscle. Origin is from the floor of the costal groove. Costal groove, you are aware of this. Floor of the costal groove of the rib above, and insertion is into the inner lip of the upper border of the rib below, and its extent is from the lateral border of the sternum anteriorly to the angle of the rib posteriorly. That is, origin is from the costal groove, insertion is into the inner lip of the upper border or the superior border of the rib below, and extent is from the lateral border of the sternum. This is the sternum, and here is the internal intercostal muscle from the lateral border of the sternum to the angle of the rib. So this is the internal intercostal muscle. You can see in this slide the external intercostal and the internal intercostal muscle. Then we talk about the innermost muscle, that is the transversus thoracis muscle, and the three types of muscles which constitute this transversus thoracis are subcostalis, intercostalis intimi, I repeat, and sternocostalis. The origin of these muscles, in fact they are very small muscles, the origin is from the upper margin of the subcostal groove of the rib above, or you can just remember from the subcostal groove, the upper margin part, and insertion is superior border of rib below, that is, it is inner to the attachment of the internal intercostal muscle, and extent is that it is present in middle 2/4 of the lower intercostal space. Direction of the fibers is the same as the internal intercostal, that is at the right angle to the direction of the external intercostal. Means internal intercostal muscle and the transversus thoracis muscle, the direction of fibers is the same. Here is a slide showing you the we are seeing the thoracic cavity, within the thoracic cavity, and we can see this internal intercostal muscles, and here is the transversus thoracis muscles. Now we come to intercostal nerves. Intercostal nerves are the nerves which are present in between the intercostal spaces, and these are the anterior primary rami. Anterior primary rami means division of T1 to T11 spinal nerves. These are the nerves of the anterior primary rami of T1 to T11 after the dorsal primary rami is given off. And the term neurovascular bundle means nerve, artery, vein, and this bundle lies in between the internal and the innermost intercostal muscles. The various nerves we'll study. The T1 and T2, they also supply the upper limb. T3 to T6, they supply only thoracic wall, and therefore they are known as typical intercostal nerves. Typical intercostal nerves. While T7 to T11, they also supply the abdominal wall, and therefore they are also known as thoraco-abdominal nerves. Thoraco-abdominal nerves. Then T12, which is also known as subcostal nerves, that is the anterior primary rami of T12. It is for the abdominal wall and the skin of the buttock. So the typical intercostal nerve is by the T3 and the T6. They supply only thoracic wall. If you see this slide, this is the anterior aspect, the posterior aspect, the subcostal groove you can see, and you can also see the various structures: vein, artery, nerve. Can you see? And anteriorly they give off the perforating branches. You can see over here. Okay. This diagram is very important from your examination point of view, and this is the diagram of typical thoracic nerve. This is the transverse section of the spinal cord, showing you the dorsal root ganglion, the two divisions, dorsal root ganglion, and this is the ventral ramus, the dorsal ramus, the ventral ramus, and this ventral ramus gives off branches, that is a dorsal branch and a ventral branch. I'll just repeat once again, please. This is the transverse section of the spinal cord, the dorsal ramus and the ventral ramus. Here is a dorsal root ganglion. The dorsal ramus gives off branches, the lateral as well as medial branches. Can you see this dorsal ramus and the two branches, medial and lateral branches? Okay. The ventral ramus, it gives off the branches. This is the anterior cutaneous branch, and here is, I'm sorry, okay, this gives off, the ventral ramus gives off the anterior cutaneous branch and the lateral cutaneous branch. Also we have the pleural branches, the muscular branches and the periosteal branches. This is the diagram which you should really practice and is very important. This is the diagram of the typical thoracic nerve. It's given in your books. Then we have the vessels, that is the intercostal vessels. They are arranged in two groups, anterior and posterior. Anterior are two branches and posterior is one. The anterior intercostal arteries arise from the internal thoracic artery and a musculophrenic artery. The first and second posterior intercostal arteries, they arise from the subclavian artery, while third to 11 posterior intercostal arteries, they arise from the descending thoracic aorta. So there are two groups, anterior and posterior. Okay, anterior arise from which two arteries? Internal thoracic and musculophrenic arteries. While in the case of posterior, first and second are from the subclavian artery and third and 11 are from the descending thoracic aorta. And the veins, they correspond to the arteries, and they are also arranged in two groups, two anterior and one posterior. This is the same slide showing you the various branches. Okay, this is the arrangement of the anterior intercostal artery and vein, you can see over here. Finally, we come to the applied. In applied, there is one term that is known as root pain. Root pain. Root pain is when there is compression or there is damage in the nerves. So it can result in pain, increased sensitivity or numbness, as well as there is muscular weakness. So root pain occurs due to the irritation of intercostal nerves, and they cause severe pain which is referred to the front of the chest or abdomen at the peripheral termination of nerve. So it's not a good thing. Sometimes there is formation of pus due to so many causes, like tuberculosis, one of the main cause. There is pus from the vertebral column. It tends to track around the thorax along the course of the neurovascular bundle. In conditions like bypass, coronary bypass surgery, so internal thoracic artery is used as a graft. Then in the case of producing local anesthesia, intercostal nerve block is given. This block is given near its origin, just lateral to the vertebra. Then there is a condition, a disease known as shingles, that is caused by the virus, herpes zoster virus. This can occur in the thoracic ganglion. This virus remains dormant, and when it becomes active, it produces cutaneous vesicles in the dermatomal area of the intercostal nerve. Yes, you can see the reactivation of the virus and here's a latent virus, the sleeping virus. In the reactivation of virus, it produces the various vesicles, the erythematous, vesicular structures, shingles is known as shingles. That's all for the today. That's all for today, and I hope you have understood the lecture, and you're always welcome. Thank you so much.